I'm Willarda Edwards, asking for the privilege of a second term on the board. I think we all agree that this has been a year like no other in our professional lives. What's brought me the most comfort is knowing my office colleagues have my back as I have theirs. That's the role of a leader, and that's the role our board must play in serving its members. More than ever, this next year demands trustees experienced in dealing with policymakers and in developing workable policies through consensus. Leaders who are accountable and accessible to you, who understand their responsibility to carry out the will of our house, who have your back. I believe my first term on our board has demonstrated that I have that skill set, and I hope we share the belief that I've represented you well. I look forward to your questions.
How is your typical professional day divided? Not during this pandemic, but before and after. What percent is spent in direct patient care, research, teaching, administrative, or other modes? What will this practice experience bring to our BOT?
I am in private practice in Baltimore in internal medicine and have been for 30 some years now. And I have a partner. I am the managing partner in my office. And so I'm taking care of all the administrative, paying my colleague as well as our staff, and then also taking care of patients. And I have also had the benefit of being a part of organized medicine and being able to bring in new innovation as a result of talking and working collaboratively in organized medicine with my state or on the national level that helps our practice move forward with new innovation. When it came down to the COVID virus, we were really able to use the guidance of our medical society to make sure that we had the funding to keep our staff, to get the PPP, and then also to access PPE. So my private practice really helps me a lot in terms of, and organized medicine helps me with my private practice.
What specific ideas do you have to improve and retain our membership?
Wow. Yeah, specific ideas. Like I said, just in this new change with the COVID, I found that my medical society was very helpful in helping people get into telehealth, help us move forward with getting the PPP for our staff, and then also the fact that we are able to disseminate a lot of information and work collaboratively with our state and health department because of organized medicine. And when we open that up to not just the people who are current members, but also to all physicians in the area, I felt that that was a major way of bringing in more people to medical society, to organized medicine in general. So I think that there have been a lot of negatives with COVID, but I think that there are a lot of things that we can do positively for our community, for our profession in general.
What are your thoughts regarding healthcare reform? Specifically, comment on single payer and a public option.
I think that we need to look at what we have done in terms of organized medicine stand with respect to coverage for everyone and universal coverage. I strongly believe in universal coverage. I believe in people having options, but I also realize, and I think people have already commented on the fact that with us having the problem with people being unemployed, what we formerly had before in terms of employer issued insurance, we've got to take another look at that. We need something that is portable for patients regardless of their employment status. And so I really hope that all of us will now take a better look at what the options could possibly be. My major issue is always to make sure that we have universal coverage for people and that we always obviously have a safety net as well. So there's going to be a lot that we need to do together, and the COVID is going to push us in that direction.